Gauteng Health Department has issued a statement dismissing claims that a warning letter has been issued to Dr Tim de Maayer. Dr. de Maayer is the pediatric gastroenterologist at the Rahima Moosa Mother and Child Hospital in Johannesburg. You may remember there was a huge reaction. He published an open letter criticising the hospital, criticising the conditions at the hospital, and suggesting that, in fact, the conditions were so bad they posed a risk to the young babies who are being born there. That led to the fact that he was going to face disciplinary action. That led to a huge outcry and a meeting involving the doctor, the CEO, and the Gauteng Health MEC, at which we were told that no disciplinary action would be taken against him. Today, Jack Blum, the spokesperson for health in Gauteng for the Democratic Alliance, has claimed that de Maayer has been issued with a written warning, or a final written warning now. We're joined now by Motalatale Modiba, Head of Communications at Gauteng Health. Motalatale, good afternoon to you. Has disciplinary action been taken against Dr Tim de Maayer?
No, Stephen, no such actions have been taken, as we have consistently been saying over a period of time, that we have listened to the voices out there, the public outcry, and we've had several engagements, and there is no, I can confirm now, speaking to you, that there is no disciplinary action that has been taken currently. There is no warning letter that has been issued, and I think that's why in our statement we have asked Mr. Blum to actually assist us in publicly publishing the so-called disciplinary letter that has been issued. None has been issued, and we can confirm that.
So just to be clear, de Maayer was in a particular position regarding, I imagine, his record and whatever disciplinary record, if he had one, before the open letter. Now, a couple of months later, he's in exactly the same position. Nothing's been entered into that disciplinary record as a result of his publishing of that letter.
Correct. You'd recall that after the letter was published and the whole matter went public and so forth, you'd recall that there was an intention to suspend for certain investigations to take place, and the executive authority, then the MEC, Dr Maayer, then intervened and had an engagement with the team at Rahima Moosa, which then meant that even that intention to suspend was put aside. And since then, there were further engagements that had transpired between management and the affected doctor, including other interested parties. And I can confirm to you that there is no disciplinary process that is being sort of pursued against him, but also there is no, in fact, there was never a warning letter that was issued. It was discussed, but there was never a warning letter that was issued because, I mean, further engagements, we realized that there's no longer a point to pursue that point, given that we have had those further open engagements. And from those, it was agreed among the parties that there's no longer a need to pursue that. And I think it's very mischievous. We have published the response that the MEC, the acting MEC for health, Ms. Nomantu Komorane-Hawker, gave today at the legislature, and there were two specific questions that were asked, which I think someone deliberately placed around those particular questions. The first question was, which further disciplinary measures were being considered? And then the honest truth was that the issue of the letter was discussed. And then it says, what happened to those disciplinary processes? Why were they abandoned? Then we explained that because of the further engagements among the parties, it was then realized that no, there's no longer a need to even go that route. And hence, there was no disciplinary letter that was ever issued.
Okay. The CEO of the hospital, Newzroom, she's still in her position, is that right?
Correct, yes.
And no action's been taken against her, I presume?
At this point, there's no action that has been taken against her, yes.
Okay. Do you dispute any of the points of fact that de Maayer made in his open letter about conditions at the hospital?
Look, Steve, if you'd recall that at the time when Dr. de Maayer issued the letter, I think the department issued a response, a comprehensive response then, and where we were very upfront to say we do acknowledge that there are multiple challenges that are being faced by the healthcare system, and in particular, certain challenges that have been raised at Rahima Moosa Hospital itself. And I think the department committed itself to working with multiple stakeholders, including the very same clinicians who are at the facility, to actually work on addressing those. And that's why, following that particular letter, we have since had a couple of meetings with the recent one that has taken place about a couple of weeks ago with the IM movement, where we looked at different ways and what are some of the recommendations that they are making, and where are we as a department, and how do we work together to actually work at addressing many of the challenges that they've raised, because some of those challenges are not challenges that are going to be addressed overnight, but they do require that there be a program that is laid down in terms of being able to systematically address those particular challenges.
Okay, so to put it another way, is it safe for babies and children and mothers at the Rahima Moosa Mother and Child Hospital? Because we saw what the doctor wrote. You won't dispute the facts. I accept your earlier statement that you had to acknowledge all of this. The question is the hospital going to improve? Is it improving?
It is safe for mothers to go and give birth at Rahima Moosa. I'm sure that you'll attest that since then until now, you have not heard if there were incidences that sought to suggest that it was not safe. You would have been the first people to actually be alerted, and probably you would have been camping outside the hospital covering. Rahima Moosa still continues, despite its challenges, to be one of the best facilities that we have in terms of providing services to mother and children. In fact, I think it's the only such facility in Southern Africa that specifically is dedicated to providing services to mothers and children. Yes, it is safe for members of the public to go there to receive services. Yes, there are challenges that we're working on. I think there is a determination from the side of the department, having acknowledged some of the shortfalls that are there, to work together with multiple stakeholders to address those particular challenges. But the public should not have to worry about whether it's safe for them to actually come and receive service at the facility.
Motalatale, I must just ask why we're speaking to you. There's been a series of stories on News 24, I'm sure you've seen them, about the assassination of Babeta Diekaran, the person who was blowing the whistle on corruption involving, we now understand, the Tembisa Hospital. They're reporting that her warnings went unheeded, that no action was taken. Are you able to respond to those claims?
Look, at this stage, I'm not able to respond to that, except to say that we have taken note of what News 24 has been reporting, and of course there are law enforcement agencies that are actually probing into many of the issues that are raised, and that means that to a certain degree they were constrained in terms of certain things that we would like to say as a department around the particular matter. We are very much interested ourselves to get to the bottom of the issue and to ensure that no stone is left unturned to get to hold to account those that might be responsible, one for the matter of Babita, but secondly, even for if there are any irregularities that they have been identified, that those get to be addressed. But for now, I think it's important that we allow the unfolding processes to actually take their course, and we're very supportive of, I think, those unfolding processes at the moment.
Motalatale Modiba, thank you very much indeed, Head of Communication for Gauteng Health Department.